All right, welcome to another edition of the Investing Across Borders show. We're very excited because this is a topic that a lot of people bring up when we're talking about investing and immigrating across borders. And today we have we have two special guests, Patrick Mazer and Alejandra Kalman. So thank you guys for joining us today. We're going to be talking a lot about the healthcare options for foreign nationals in the U.S., especially for Canadians, because that's most of our clients. So please, Patrick, why don't we start with you so you can introduce yourself, and then Alejandra, if you can please introduce yourself, and we'll start the conversation there.
Excellent. Well, first of all, great to be on here. And I know that this is a huge value for anybody that is looking to live in the United States. And I know how healthcare is extremely expensive. And coming from Canada, where you're used to getting it for free, and then you find out in the United States, thousands and thousands, tens of thousands of dollars. What we found is an option for anybody that is a Canadian resident that's looking to live in the United States and wants medical coverage in the United States. And when I say medical coverage, we actually represent a company called Impact Health Sharing. And what Impact Health Sharing does is gives full medical coverage for anyone. That could be from an ambulance ride to a doctor visit, God forbid, an operation. They cover everything that anybody would need, major medical. And what's exciting is there's no network. So I know a lot of people, when they come and they realize that, hey, if I do get health coverage, it's only for specific doctors, maybe in my area, maybe specific hospitals only. But what we represent is a company that has no medical restrictions where you go. So if you want to go to John Hopkins, you're able to do so. If you want to go to the best doctor in all of the United States, our company will allow you to go as a member. Now, what makes it so unique is not only as an American citizen, you can become a customer, but you also can become a customer if you are a Canadian citizen. Now, there's one thing that all of you would need to have to participate, and that would be an ITIN. So an ITIN number is the only prerequisite that we have for somebody that wants to opt in. Now, what's exciting about our healthcare is there's no limit of when you can do it. So if you want to start April 1 or May 1, you're able to come and go as you please. And what I mean by that is there's no enrollment times like there would normally be for those of you that are familiar with how it works in the United States. So if you move here May 1st, great, we can start giving you major medical coverage starting that particular month that you choose. And there's family options as well. So for people that maybe bring in their spouse or their children and you want to cover everyone, we're able to do that as well. So just to give you a quick understanding, we've got a slide that'll talk a little bit about, what Impact Health Sharing is, just so that you get a little better understanding of them. We'll introduce you to Impact Health Sharing, and then we'll just talk about some of the advantages to this specific product. So if you guys could pull the slide up, that'd be great. I'll start
Sure.
with.
Why don't we get started with that? Before you start though, I want to just mention something. If people have questions, you're able to see them, Patrick, in the chat. So
Okay.
if anybody has any questions, please post them in the chat. These are amazing options that you have available as a foreign national to be able to get healthcare. So okay, so here are the slides, and if anybody has questions, again, just post them in the chat so that Patrick can see them.
Awesome. Yeah, we welcome questions for sure, and thank you for pointing that out. So the company that we represent is called Impact Health Sharing. It's a solution for the rising cost of healthcare. For those of you that have ever gotten a quote or maybe know someone that has, extremely expensive in the United States. It's one of the biggest bills that Americans have to pay. What we've got is really a modern look at an alternative to health insurance. And what I mean by that is we have a product that feels better and works better than insurance because the company Impact Health Sharing is a non-profit healthcare company. So all of the major insurance companies in the United States are for profit. So the reason why the cost is so expensive is because of how many people are benefiting for a for-profit model. This is completely rethinking healthcare in America by using a nonprofit company like Impact Health, that their entire role is to pay the medical bills of our particular members or our customers. So if you look at the next slide, this is going to give you just some basic bullet points specifically to Impact Health Sharing. And the first thing you're going to see is it's affordable. Now, normally in health insurance, people that are not U.S. residents cannot participate. I know that's been a pain point coming to the United States, where people have to fly back to Canada for a doctor's visit, or, hey, I need to go see a cardiologist, or, even some basic things. We know how important, medical coverage is for everybody. So we've got an affordable option, meaning this is 30 to 70% less than what people pay for health insurance in the United States. So you can only imagine how happy our members are to know that they actually are spending 70% less than what they normally would pay when it comes to health insurance in the United States. Access to preventative care, things like colonoscopy, or things that women need, all of that is covered. So we're actually giving every member a free physical with free blood work every time somebody signs in, and that's every year. So let's say you became a member today, you could go get a free physical, free blood work, and that could be at any doctor that you choose. Now, as mentioned, we cover all major medical events. God forbid somebody's going to need an operation of some sort, we cover it. A double lung transplant, we cover it. Cancer treatment, we cover it. So imagine not only having access to go to any doctor you want in the United States, you could go to the very best doctor in the United States. And that's something where you're going to find a lot of your American friends are stuck in programs that are network sensitive. What does that mean? That means you got to go to the doctor they say, not the doctor you want. And that's a huge distinction you're going to find in the United States, because look, not all doctors, I think we can agree, have the level of expertise that maybe you're looking to get specifically for a situation you or your loved one might have. We also cover mental health. Again, that's something that a lot of people don't get with the traditional health coverage. Chiropractic, for those of you that love to go to the chiropractor, we can actually facilitate that. We do pay for chiropractic visits. Also physical therapists. A lot of times people are stuck in plans where physical therapy isn't covered. We do cover that as well. Now, those of you that know that the prescription market in the United States is absolutely out of control, it's a for-profit business in the United States. So what you find is the insurance company and the pharmaceutical company are all in bed together in the United States. So they do what's called marking up the cost of the prescription. So I know a lot of Canadians come to America and get sticker shock when they see how much we charge for pharmaceuticals. Well, what's nice about our company, Impact Health Sharing, is we don't make any money on the pharmaceuticals. So we actually give you the pharmaceuticals at the price of the drug. Had a woman that was taking a drug called metformin, pretty popular. She had a 30-day supply. She was paying over $60 a month for this particular pharmaceutical. Came to Impact Health. A 30-day supply was $1.68. You could only imagine the shock she had to realize the savings that she was able to get just on pharmaceuticals. So for anybody that, God forbid, needs to take some sort of prescription, just know that we're the company that we actually do not make any money on it. So we're going to give it to you at the actual cost, which I know has been something that's been a very delicate situation in America, where, as you can only imagine, the last place I like to take them when they're not feeling well is a doctor's office with a lot of other sick kids. So we really lean on that a lot. It's really helped us tremendously in many situations that we didn't need to go to a doctor. We just needed to see one online, wrote a script. We were able to pick up that pharmaceutical, and happy to tell you that our kids are healthy, and it worked out amazing. So another major feature you get. Now, as mentioned earlier, no network restrictions. All that basically means is you can go anytime, anywhere, any doctor you like. Just had an individual that their daughter had a very rare eye problem. And so he Googled the best doctor in the United States for what his daughter had, made an appointment, and was happy that he was able to see somebody that was able to give an opinion different than what he had heard in the past, because this doctor specialized specifically in what this particular customer needed. And then you heard earlier, no restrictions on enrollment. That means if you move June 1 to the United States, you can start getting health coverage that same month. So what's nice about it is there's no gap in your health coverage. If you're leaving Canada, you're coming to the United States saying, hey, I'm walking out of the country May 15th. I'm going to be in the United States June 1. We can start covering you June 1 and make sure that all your major medical needs will always be covered. Now, just to give you a last slide, it's going to talk a little bit about just pricing, and then I'm going to do a real live price just so you guys know. But don't be sticker shocked. We actually started $73 for single people. So if you're a single person coming to the United States, you could pay as little as $73. Also for families, you could pay as little as $378 a month for a family. So again, this is a great option. It's something that we're having tremendous success with for individuals like yourself that know how difficult it is to get this kind of coverage in the United States, especially if you're not a US citizen. So again, the only thing that'll stop a Canadian resident from being a customer is they need to have an I-10. The I-10 is the only thing that they're going to ask in order for you to get coverage for yourself or coverage for your family. And so I know I've got Alejandra on here as well. She's a regional vice president with the company. She's been helping countless people all over North America get affordable health coverage as well. And Alejandra, I don't know if there's anything you wanted to add. I know I ran through some of the information here today rather quick, but I know you've got a really unique perspective as well on helping people with affordable health care.
Absolutely. Well, thank you so much, Patrick. Thank you, Miri, for having us on here. I am foreign, so God only knows that when I came to the United States, my biggest concern was healthcare, and I didn't have any options at that moment. And Miri, if you want, we can stop sharing this, but right there, somebody asked a question, what if I am a British citizen? And that is a great question. As of right now, the foreign nationals that we can help with an I-10 number if they don't have social yet, that is Canada, Mexico, and Guatemala. And I know that maybe Canada and Mexico is understandable because they're border countries, but you say how Guatemala came into this equation. It's because those three countries uses the exact same system for verification of identity for government IDs that the United States does. And so Impact can verify you if you're Canadian, if you're Mexican, or if you're from Guatemala, can verify your ID with your government issued ID from your country. And then they can attach the I-10 to be able to provide you with this. Now, even if you got a temporary social security number in the process of whatever you're doing already to come into the United States, then with that, you can actually, even if you are not yet a citizen of the United States, you can actually participate, but you either need a social or you need an I-10. As outside of that, Patrick, I think I don't have anything else to add. He really was great. I tell you, I always say I'm an Impact customer myself. I broke my foot 6 weeks ago. Unfortunately, you cannot see my feet, but I have a broken foot. And, one of the biggest blessings to me was I didn't have to look in network out of network. That's a huge pain here in the United States. If you're not from here, you yet don't know, but there are networks of doctors that work with specifics, insurances. And so if you fall into that, the problem with that is like in the middle of your agony, you have to start searching, where can I really go for treatment? So I just went to the first urgent care that I possibly could go. And it was really reassuring 4 days after my injury to get a phone call from Impact saying they had actually gotten a bill from the urgent care and acknowledging, hey, we understand that you have a broken foot. Which providers you're going to be seeing next? So we can help you find the providers. We can help you with the billing. And so they wanted to take the pressure of the billing away from me in a moment where they knew I needed it. And I never had experience like that. I've been in this country for 23 years now, and Miri, you are from here, so you can attest. I never had an experience where my healthcare cared enough to try to take that away from us. So I love Impact. I think we have a huge blessing, Miri. And if you want to show people, anybody how to quote, somebody just asked us something there for my mom with the Indian passport. She has social security and is waiting. If she does have a social security number, we can help her. Yes, we just need either a social or we need an IT.
Awesome, awesome. And so let's do this. A couple things. One, I'm loving the questions. I love the interaction here. We're going to show you how simple it is to get a quote, so you can actually quote yourself. That way, you don't have to talk to anybody. If that's something you're interested in doing, we're going to show you how simple that is. Also, how to add family members so you can get an idea what you would pay. So the quote you see on the website is the quote that you are going to pay. So we're very transparent with that as well. So just to give you an idea, maybe you could share the website. This is
Yeah, I actually, Patrick, before you start, one of our team members just posted the link in the chat
awesome.
because people want to find out more information. So if anybody has more questions, feel free to post them there. But Patrick is going to guide us as to what do we need to do once we go into this website.
So there's three things that you're going to see at the website. Number one is get a quote. So that's going to allow for you, the customer, to see what would you pay. And it goes by the year you were born. So we're just going to give you just a random quote. We said somebody was born in 1976. Let's just put it down to one member. So let's say it's a single person. They're looking for a quote. The year you were born is what's going to determine. Now you can see that healthcare is going to start as low as $130 all the way to $268 a month. The difference would be what we would know as your primary responsibility, or for those of you that are familiar with insurance in the United States, they would call that a deductible. So that means $0 to $2,500 you would be responsible for. After $2,500, Impact Health would pay 90% of the bill up until you had a total out of pocket of $5,000 per household. So $0 to $2,500 you would be responsible for. After that, Impact would pay 90% of any medical bill that you have, limited to $5,000 per household. And again, you can see that we have a difference in deductibles or primary responsibility: $2,500, $5,000, $7,500, or $10,000. The drug pricing immediately kicks in for you, regardless if you hit your primary responsibility. You also get access to any doctor. We reprice every bill. So in the United States, when the doctor sends the bill to Impact negotiates the bill for you. So what that means is that you have somebody that's actually only going to make you pay what the real cost of the procedure is. And I'm sure you might have a story or two of people that walked into the emergency room, got a $3,000 bill from the emergency room. How we would work is that bill would go to Impact. Impact would negotiate the bill. And in my case, a $3,000 bill was really $138 after Impact negotiated. So although the bill said $3,000, Impact went through, negotiated the bill, and it was $138. And because I was below my primary responsibility or my deductible, I had to pay the $138, but it went towards my $2,500, if that makes sense, meaning working my way to eventually I'll have them paying their 90%. Now, if we go back to the top and we put in more than one family member.
May I add something to that real quick? If it's, for example, your annual wellness check or your MD live, your live doctors, your telemedicine, it does not go against the deductible. Those are things that are already included. What goes is, we don't call it deductible, it's a primary responsibility amount, right? So against that $2,500 or $5,000, the only thing that goes is those things outside, like me, I broke my foot or you needed surgery. But if it's something that's already included within Impact, such as your wellness annual checks, your pap smears, your mammograms, your annual blood work, or it is telemedicine, it's completely included. Just wanted to make sure that we clarify that.
Thank you so much, Alejandra. And if we go back up, a great point she made. Let's say that there's two people in the family. You can see how you can change the number of applicants. Let's say you're a husband and wife and you both want medical coverage. We go by the oldest person in the house. In this case, it was 1976. We said that's how old they were. And let's say that the wife or the spouse was a little younger. Great. Now it's a combined. So for two people, it could be as low as $300 a month, all the way to $476 as a combined deductible. Now, here's what's unique. If you page to the bottom of this website, you're going to see that there's a way for you to get information. Maybe you want to talk to Impact and you want somebody that can answer basic questions, or maybe you have, just additional information that you want to get a little more from. You can go right to the website. You can click on request information, and somebody from Impact over the next 2 or 3 days will call you up and walk you through any questions you might have. Now, here's the second part to that. You can also sign up yourself, meaning you don't need to talk to anybody. If you're on here today and you said, hey, look, this is a fit for me, I'm extremely excited, I can, get affordable health care in America, my family's ready to move tomorrow, you can go to the website today and you can get started today. So if you look at the top of the website, you're going to see where it says enroll now. And that's just for somebody that's ready to get started. Now, when you enroll, they're going to have you pick what day you want it to start. So April 1, May 1, June 1, and you can also pick what day you want to pay, meaning every month they're going to take money out of your account. So you can pick whatever day is best suited for you as far as when they take money out of your account. Now, let's say you cancel, you're moving back to Canada and no longer need any sort of health coverage here in the United States. What's great about that is you can cancel anytime and you can enroll anytime. So there's no commitment here or contract here or something that we're going to hold you to. And also there's an opportunity. I know a lot of people are going to naturally want to refer this. If it's something where you're looking to maybe be a representative, maybe you're saying, heck, this sounds great, I got a lot of friends that I think would benefit from that. You can also reach out to the individuals here investing across borders, and they can show you how simple that would be as well. We're always looking for some good representatives that are interested in creating revenue. What's great is you can still be a representative and you don't have to be an American citizen. So you can be a Canadian citizen and rep the product. So I've got lots of Canadians that are repping this product because they have friends in the United States and they like to make American money. So we actually pay our commissions to you in US dollars. So another great opportunity for the entrepreneurs that are there, the business-minded people that are looking at this saying, heck, this is exciting. I never imagined being able to offer healthcare. And look, I know people that come to America just for medical procedures. And I'm sure all of you guys know them as well, where they want to go to the Mayo Clinic or they want to go to John Hopkins or they, you know what I mean? And that's out of the pocket for them, meaning in most cases, that's a lot of money. So here's another option as well to be able to access the U.S. Medical system without having to be a U.S. citizen. So as you mentioned, we're pretty excited about the partnership and bringing a value to the community and knowing how big of a pain point this has been for anybody that's looking for affordable healthcare in the United States. And Alejandra, any closing comments?
Yes, I just wanted to make one more clarification. As you're doing a quote, if you have a family with children, you're going to see that the quote says 3+. But it doesn't say 4, 5, 6, 7, 8, 9. So if you have 10 kids, it's your lucky day. You're only going to pay for 3 members, and then the rest are going to be free. So that's important to clarify as well. And for that person that asked, the British citizens could benefit from this, not without the social, but if you did wanted to do the portion that Patrick talked about, where you can refer your friends in the United States with this. As a British citizen, you can. We have 27 countries that qualify for this, and your country is one of them. So just wanted to clarify that part. And thank you, Miri, for your time here today.
Yeah, I think it's a great option. A lot of times people are looking for, they're moving their whole lives, and healthcare is a big part of it, and we don't take that lightly. So that's why we bring experts to give you options. We brought somebody to help you with financing, because you obviously need to be able to find a place to live. We have agents all over the US that are able to help you find that property that you've been wanting to, so that you can move and live in a home. And this is just another one of those things that every week we bring somebody in who can advise us and who can help us. And in all of our clients and everybody here in the group on Facebook, whether you're Canadian or not, this is a really great option. I mean, I have obviously insurance because I live here in the US, and just listening to all this makes me want to join, just because there's a lot of benefits. So this is great. I love that this exists, because this is definitely something needed for all of our friends, whether they're foreigners or not. So I do want to thank you for joining us today. It has been such a wonderful presentation. And again, we're going to be back next week. We have another presentation for you guys. And we also have a masterclass coming up on Tuesday, the 14th. So make sure that you register for that. Raymond, please put that in the chat. It's investingacrossborders.net/masterclass. And we talk about a lot of different things in the masterclass. This is a little bit more specialized to the topic of healthcare, for example, today. But I definitely suggest and advise you all to join us because it's going to be amazing. There's new stuff coming up that we're preparing for everybody. So please, there's a link to our masterclass. And also, I do want to mention one more thing. If people are looking to investing or immigrating across borders, these options like healthcare is so important. But the first thing that we need to do is to have a plan, to understand what it is that we're going to be doing so that you can be advised on the right steps to take. So in order to do that, Raymond, please put the link to our consults so that people can pay for the consults and have information about what it is that they're going to do. That's always going to be your first step because we need to advise you on what type of visa you would need or what type of information you would need. So it's investingacrossborders.net/consult. All right, guys. So thank you for being here again, Patrick and Alejandra. It's been a pleasure. And we'll see you guys next week. Have a nice day.
Bye, everybody.